Uganda is one of Africa's most rapidly urbanizing countries, with a population base estimated at about 34 million. A high population growth rate of 3.2% and a high rate of urban growth estimated at over 5% per annum. This has played catalyst to the development of slums, largely attributed to unbalanced rural and urban growth divide. Healthcare is a challenge to them, social services in the latter. According to the UN Habitat Observatory report of 2007, Uganda is among the developing countries with first annual slum growth rate, averaging at 5.32%, implying there are about 3.5 million Ugandans living in slums today, estimated to reach 8 million by 2020. Kampala leads with prominent slums including Makerere Chivolo, Kamocha Chifumbira Zone, Banda, Wabigalo, Namuwongo, Katanga, Kalere, Nsambya and Waisi. Other districts include Jinja, Mbale and Gulu. To sustain themselves and their families, the slum dwellers engage in informal jobs like security guards, operating retail shops and kiosks, supermarket attendants, pump attendants, boda riding, fruit and food vending, car washing and prostitution. From their sweat, slum dwellers' meager salary hardly meet their basic needs, considering that Uganda has no minimum wage legislations. This leaves them permanently held hostage to slums. These poorly facilitated mizigo are rented at a fee as low as 5,000 shillings, and they often lack toilets or latrines, contrary to the Public Health Act of 1964, making slums worse than rural areas. Life in the slums is not any cheap though. While water coverage in Kampala, for example, is estimated at 65%, it costs 3 times more to buy water in the city slum than it does in the planned areas such as Kololo and Nakasero. A Kampala Integrated Environmental Planning Project, KIEMP 2010 report says, however, this is just a replicate of the life in rural areas where only food is cheap. Basic needs like healthcare is a challenge to them. And with the high poverty levels, many Ugandans in the rural areas cannot meet transport costs to even the free health services that may be available. With 52% national immunization coverage, Uganda has the lowest number of fully immunized children in East Africa against the 90% target of the Global Immunization Vision and Strategy. This makes Uganda the country with the highest infant mortality rate in the region.
Well, this year, next year, each and every year, 1 million children die of malaria. What is the solution to save the African children then?
Malaria is among the most killers of the little ones here. The government of Uganda has tried her level best to reduce this rate with all the efforts made, and calls to Ugandans to sleep under mosquito nets, mostly the young below 5 years. But it is really hard for her only to reach every Ugandan.
Together under vector control. If you control vectors, you will eliminate these diseases. Vector means the insect which spreads the disease. That's what the budgeting should be about.
This calls for individual intervention, and Wambayo Samuel, the executive director of Kids Club Kampala, engaged the war. He lately started soliciting for funds from which he buys nets and gives out to those without one.
Due to the condition these children live in and the area surrounding them, they are very vulnerable to diseases such as cholera, dysentery, malaria, because of the bleeding, the mosquito bleeding places around them. There is an element of too much malaria in these areas. So we base on this to see how best we can do physical intervention. And right now, as you see, we are giving mosquito nets, we are giving them drugs for cholera, and so many things.
He and his group mostly target the poor.
The children we work with as Kids Club Kampala are in desperate situation. They need encouragement, they need love and physical intervention in the form of basic needs and a chance to play, to live their lives as children.
The volunteers have got desires of moving house to house, village per village, district per village until the country is covered. However, the organization is stretched with limited funds.
The work we do is entirely limited by funds right now. We need a lot of financial support to boost the work, and this work to ensure that we eliminate and avoid malaria. That's why we are calling upon leaders, we are calling upon humanitarian agencies, NGOs, presidents. We are calling upon you who is watching me to come in and join us and ensure that this work is done and effectively. We welcome any kind of donation. Financial support in kind, a mosquito net in kind is much welcome.
The work done so far has impacted on people's lives in the areas reached. Kids Club Kampala is engaging the vulnerable in different aspects of life, which include providing training opportunities for them on the handwork. Samuel believes that when one is trained, he can start up his own new life and bring himself from the very poor life. He meets orphans, widows, and the poor from different corners. It is well known that education is the key to everything, and it is the best gift one can give to any child. Kids Club Kampala provides so to some of the orphans that they meet. The major challenge to Ugandans is poverty. And if you go by the United Nations Fund for Population Activities, UNFPA, on the current estimated 34.5 million people in Uganda, 23.1 million are prone to poverty and about 8.4 million of them are trapped in absolute poverty. However, this cannot change unless we come together and fight for better living, not only for you, but for the generation.